All right, excellent. Now, you also do wisdom teeth removal in your office, is
We
that
do.
correct?
We
Okay,
do. That's no, I would say a majority, but a large proportion of what we do on a daily basis.
okay. And who are your typical patients then? Are you mostly working with teenagers or?
We treat everybody. Most wisdom teeth patients are going to be somewhere between the ages of 14 and 21. That being stated, I think the oldest patient I've ever taken a wisdom tooth out on was 92 years old. The youngest is probably 11 or 12. They're not formed very much before that point. A majority of our wisdom tooth teeth extractions we do with the patient sedated, both for their comfort and for our ease of treatment. We can do a typical set of wisdom teeth with the patient sedated somewhere in the range of a half hour. Whereas if someone's awake and wants to do it just numbing medicine, it takes about 45 minutes to an hour. So it adds some time. Um, as stated before, we have modern monitoring techniques. We're able to provide for patients with a level of sedation that keeps them very comfortable and unaware that we've even done a procedure. My favorite thing to hear on wake up is the patient say, "Hey, have we started yet?" That means that it's been a good case and anesthesia went well and they were nice and comfortable. Um, that being stated, we don't sedate everybody. We have patients who just don't feel comfortable with it, or for financial reasons they don't want to be sedated, and we certainly provide comfortable treatment with just numbing medicine and good surgical technique.
Sure. What are a couple of reasons why people will generally have their wisdom teeth removed?
So there's some good studies that have been done looking at why do we remove wisdom teeth. The primary reasons, one is to prevent pathology. We do see cysts and tumors that can develop around impacted wisdom teeth. The overall rate is low, but for that particular patient who has a cyst or tumor, it can be devastating. I had one patient who was about 26 years old, hadn't had his wisdom teeth out. It developed a large cyst that went from basically the ear to the middle of the jaw, all within the bone. We had to remove all the teeth on that side, remove the cyst. He spent a number of days in the hospital, had to go back and get dental implants. Probably cost somewhere in the range of $50,000 to get him recuperated. Whereas had we taken the wisdom teeth out when he was 16, the total cost is significantly cheaper. I mean, somewhere in the range of $1,300 to $2,000. So I mean that comparison there is really easy to see. It would be a lot cheaper to treat on the front end. So to prevent
What's the
pathology, we
saying
also
that
see that.
an ounce of prevention is worth a pound of cure, I think
Oh,
is
for sure, for sure. We also see that periodontal disease begins back around those impacted wisdom teeth. We find that people can't clean down around those teeth because there's just not enough room in the jaws. And so infections will start back there and things of that nature. So to prevent infection, to prevent pathology, and then the other one, the biggest reason why we would take them out is really peace of mind. We take them out on a lot of patients who just want to make sure that that's done. They don't have to worry about that pathology. And we'll take them out to treat pathology too. If someone already has a tumor, already has bone loss and things of that nature, we'll remove them. So those are probably the biggest reasons: to prevent disease and then to treat disease.
now,
Um,
now do you wisdom teeth removal in the Salt Lake City area only, or do you also work in other areas?
So my primary office is here in Salt Lake, up in Holiday, 45th South, 2180 East. I do work for a couple of other offices. I work in Layton and Clinton and Midvale on occasion, but our primary office is here.
Okay.
And we have patients. I have patients from Elko to Evanston, from Logan to St. George come up for us to treat them.